So basically the agenda will run like this. We'll be hearing from Adam, and I know Adam, you're not able to stay for the full meeting, but about half of it. So we'll get through as many of the questions as we can during that time as well. So we'll hear first from Adam with an overview of the situation. Then we'll be hearing from our resident Dr. MPs, Richard and Tim, about the current how Victoria is tackling the current crisis. And then we'll be hearing from Janet and Ellen, who are spearheading some of our most significant climate and environment campaigns, about what's happening on the campaign front, because we've got lots of questions from people about those campaigns and how they're continuing and how you can get involved as well. So without further ado, I'd like to hand over to Adam. Welcome, Adam.
Thanks, Sam. Hi, everyone. I'm coming to you from Wurundjeri land, and I hope that you can all hear and see me okay. Thanks very much for having me. I do have to go at past because I'm talking to someone from a local business that puts on weddings, and their question is, when are these social restrictions going to be lifted? When are we going to be able to have more than 100 people in the same place, and trying to work it out about how they're going to plan their business. And the real answer is probably that no one actually knows. And we're in an unprecedented, well, probably not unprecedented situation in that we've had these kind of pandemics before, and you're going to hear from Richard and Tim, who are going to give you a lot more detail and insight into the health side of it than I possibly could. But certainly for so long as many of us have been alive, this is an unprecedented situation. And one of the things that is crystal clear in it is that the economic and social impacts are huge, and they're ongoing, and they probably haven't been fully felt yet. I think it's fair to say, probably about at quarter time in this crisis, where we've had the initial impacts and the initial social distancing restrictions that have been put in place in order to mitigate the spread of the virus. But as I think Tim and Richard will step you through, there's no clear time frame as to when they can be lifted, or even if they can be lifted fully. And what we will be like when we come out the other side is something that is as yet a bit of a work in progress. And we've seen massive impacts on whole sectors of our economy and our society, from education, of course, right across to hospitality and retail. And we've seen probably a higher level of coordination between state and federal governments than we've seen for quite some time. I want to just tell you briefly about what has happened in Parliament and what the government has done and what our response to that has been, and then leave you with a few thoughts about where we think it's going to go next. The government, the Prime Minister, it took a little while. I think you'll see some children peeking in and coming in during the course of this. It's the life and love of Zoom meetings, as I think we're all getting to know. The first, when the virus was first announced and responses were first being considered at the federal level, I think it's fair to say that the federal government was a bit too slow, and it was certainly guilty of mixed messages. At the same time, you have the Prime Minister saying he was off to the football, and the Health Minister saying it was all right to shake hands, and then within 24 hours of each of those announcements, the opposite turned out to be the case. So there were some mixed messages earlier on, and certainly some people arguing that the social restrictions and physical restrictions could have been put in place sooner. I am having my BBC TV presenter moment. That's exactly right. But since then, I think it's fair to say, probably prodded by some of the states and from some agitation, including from us and others, we now have a situation where the Prime Minister has put in place restrictions that probably meet most of what even the strongest health professional would be arguing for at this stage. So we've got restrictions that are in place. The government has responded. Firstly, they had us sit for a couple of days to pass the first stimulus package, which involved a fair amount of money for industry and for businesses, as well as what we welcomed, which was a doubling of Newstart and turning into the job seeker payment, a change that was already on the way. So we had effectively the doubling of Newstart, And we saw that extra doubling, that extra supplement being extended to a number of other groups. Thanks to our advocacy and our push when Parliament was sitting, we got it extended to students who were doing casual work as well. And if it wasn't for the Greens, those students wouldn't be getting those additional payments. What we said a couple of things when the package first hit Parliament. One was that there are too many people being left behind, and particularly people on the disability support pension and carers who are also in receipt of government benefits were excluded from this doubling or this extra coronavirus supplement that was a de facto doubling. So we got nothing from them, nothing for them. But also the point we made at the time was doubling Newstart, while it's welcomed, and then giving money to businesses, but without any requirement that businesses keep people on, is just going to send a signal to employers that, well, the government is obviously saying you can let people go because they'll be picked up in the Newstart system, in the social security system. And then within a couple of days, that's exactly what we saw. We saw depression-era dole queues, the likes of which probably we all thought we wouldn't see, and during our lifetime. So we, in that first session of Parliament, we pushed for job guarantees and for wages guarantees and said, if you're going to be handing out billions, then make sure it goes to where it's needed, which is to workers, people without a job, the people who are going to need the money to get by, but also they're going to be the ones who are going to spend the money that are going to keep businesses afloat. And if you just hand it out to the people up at the top, then that might keep the people up the top afloat, but it's not going to keep everyone else going. The government then, I think, it took them a couple of weeks to realise that we were right, and they recalled Parliament and passed a thing called the new Job Keeper package, rather. And the Job Keeper package is money that is higher than the Newstart doubling rates, about $1,500 a fortnight. That money goes to employers if they choose to keep their workers on. Now, so the first question is, are employers going to choose to keep workers on, given that a lot of them have already let them go? Don't know. And there's a report today that we're going to see at least 10% unemployment when the next figures come out. And I think for young people in particular, for reasons that I'll explain, it's going to be a lot higher than that. But the government's, those wage guarantees, again, while welcome and something that we secured and we supported through Parliament, they leave out about 1.1 million casual workers. Plus, if you weren't employed on the magic date of, I think it's the 20th of March, your employer is ineligible for it. So people who work in the arts sector, for example, who might be doing lumpy periods of work, you work for a performance, or you work for a festival, or you work for a particular gig, you save up that money that gets you through a couple of months of downtime. If you weren't employed on that magic cutoff date, then you're not going to be eligible. But the 1.5 million casuals who aren't included in this either, the government has said, well, we're not going to allow this job subsidy to go to anyone who's been employed for less than 12 months. The big problem with that is when you overlay that with the areas that are hit by the social distancing rules, like hospitality and retail, that's where young people are employed, right? And half of that 1.1 million casuals who are excluded from the government's response are young people. And so really it is going to be young people who are going to bear a very, very big brunt of this crisis. And when the employment figures come out, I reckon you're going to find that amongst young people, the youth unemployment is going to be much, much higher than it has been for a very, very long time. And then you add on to that the people that continue to leave behind, people on disability support, people with disabilities generally who are reliant on carers. And if you think about that for a moment, the people with disabilities are reliant on carers they can trust. Those carers have to come within 1.5 metres of them, like otherwise caring doesn't really work in many instances. And so what support is going to be given to those carers? Again, the government's kind of really ignored all of that. And then lastly, you look at this, the government came out and made, in a blaze of glory, an announcement that there was going to be a 6-month eviction ban for renters. but the detail's been pretty sparse. And here in Victoria, we're still, Sam and Ellen might be able to step you through it a bit more, but we're still yet to see any of that become law. And again, it was the Greens who got some results there in Tasmania, thanks to amendments passed by the Greens in Tasmania, made sure that there was an eviction ban put in place there. And in New South Wales, they passed legislation, Greens amendments that gave the minister to ban evictions with the stroke of a pen, and they've decided today that they're going to use that a bit. But we don't still have a national eviction ban or rent holidays for people who need it. So what we're finding out, and I'll sort of conclude with two things, is that there's a lot of people who've been left behind that I've mentioned, and there's a lot of sectors that have been left behind, like the arts sector, the tourism sector. We're still seeing education. We're still not seeing enough attention being paid to them. And our approach has been and will continue to be fight for the people and the sectors that have been left behind. And that's going to be our motto, and it has been our motto. So successful have we been that even in the last Parliament sitting, Anthony Albanese got up and proudly said he was going to make sure that no one left behind. So they'd obviously seen the Greens Facebook Live events and our emails that have gone out and decided that was a good thing to start saying. So the more the merrier. The last thing I'll say, and I'll finish on this, is that we're going to need a plan to recover from this. And the government talks about hibernation as if the economy is some big bear that is just going to wait of its own accord. Whereas I think it's more like someone who's been hit by a car and is in ICU and is going to require a lot of intervention and rehab to be able to walk and run again. And we just don't know how long these restrictions are going to last. And so at some point, and especially for young people, but at some point we're going to need a recovery plan to stimulate the economy again and get everyone back into jobs or having decent incomes. And I think that's where the Green New Deal comes in. And that's where we'll be pushing hard to say, we've got to fight for a better normal on the other side of this and build a new better normal where we look after everyone, where we can't just simply go back to the way that we were before. And that's where the Green New Deal and our plan for creating a lot of job creating prospects is going to be very, very exciting. So I'll leave on that and I'll hang around for a bit longer before I go and speak to my wedding events manager. But really, thanks everyone for coming along.
Thank you so much, Adam. As you've highlighted, the breadth of the response that's been required, and thank you and your federal MPs and their broader staff teams as well for all your leadership through this time. It's been so important in terms of voicing things that, if not for the Greens, wouldn't have been voiced over the last little while in these unprecedented times. So thanks so much for that overview. That's a really good grounding. I'm going to hand over next to Richard and Tim, who I mentioned are our resident doctor MPs, who've really helped inform both our health responses, but they've both also got significant public health background. So hand over to Richard and Tim. Who's going to go first?
Richard, you're on mute.
Technology, man. No, I should be okay. You can't hear me?
No, it's all good.
Good. Okay. Look, I'll be brief and then Tim will follow up. I think it's fair to say that the government's response so far has been mixed. They've got a lot of the big calls right, largely because it's been a public health-led response, and it's been led by a very expert public health community, many of whom are people that Tim and I know and respect. And so early on in the epidemic, for example, with the travel bans on China and Iran and Italy, which were very controversial at the time, were made despite the WHO recommending against them. They probably bought us some time. We've had the public health community insist on rapid sort of social distancing, but unfortunately the government's messaging on that was very contradictory, confusing, and so we called for a clear and unambiguous set of very strong restrictions, which the government ultimately, I think, accepted, and we are, in different states, we've got variations, but broadly we've got a very significant set of restrictions imposed on people, and we're doing quite well in terms of the strategy, which was to try and delay the onset of the epidemic here in Australia to allow our ICU capacity to to increase. We've done well on that front, but we've delayed the onset of the pandemic in Australia. We haven't stopped it, and it's really important, I think, to remind ourselves of that. Right through this debate, we called very early on for the modelling to be released. I think we were the first people to come out of the blocks and call for the modelling to be released. It was picked up by a number of other people, and finally the government's accepted that was a sensible course of action. We've called for the influenza vaccine to be made free to everybody. Again, there's a complication of having a flu season while we're sort of on the verge of exposure to corona. So making sure that people get access to that. And at the moment, we haven't got free universal access to the flu vaccine, and there's real concern about what a flu season is going to do in the context of this epidemic here. Really, the question for us is what's next? And as I said, I mean, this is a virus that is circulating within the community and certainly within the international community. And while Australia's done well by international comparisons in terms of limiting community transmission, most of the cases that we've had here have been from return travellers, and we've had limited community transmission because we've got a very effective contact tracing network. We've been able to get on top of those early and stop the transmission at a community level. But as I said, what we're really doing is delaying things rather than stopping them, because the moment we resume with, basically at the moment we've got social distancing, restrictions on international travel, we've got testing and contact tracing as our primary strategies. If we return to business as usual, what we're going to see is an increase in the number of cases to a point where it overwhelms our capacity to be able to test and trace and ensure that we're not getting widespread community transmission. So we're in a bit of a holding pattern. Where it goes next is, as Adam has said, there's still a great degree of uncertainty. A vaccine, it's important to remember, is not a guaranteed solution. Lots of diseases for which we've been working on for decades don't have vaccines, and so there's no guarantee we'll have a vaccine for this. Although I suspect we will, but that could be a year to 2 years away, and it may not happen at all. So in the context of at least a year before we've got a vaccine, if at all, what happens next? And what we'll probably see is a relaxation of a number of measures in an incremental fashion, with us then assessing what that does in terms of an increase to the number of cases. Because obviously the last thing we want to do is get a second wave of infection, which is much more significant, serious, and overwhelms our ICU capacity. So what do those things look like? Well, there'll be potentially, schools might reopen. We might see some businesses open again. We'll see an expansion of testing and contact tracing. I suspect international travel will be the last of those things that is relaxed. And if international travel is relaxed, there'll be much stricter quarantine and isolation measures for return travellers. But that's all ahead of us. And I think what the government's done now is commission some modelling to look at different scenarios, to look at what measures we can relax. And we'll have the public health community make that modelling available when it's done. And we obviously will be watching that with interest. The last thing I'll just say is the debate has been framed in terms of a health response versus, keeping the economy going. And I think that's a very narrow and overly simplistic way of framing what the choices look like. Really what we're dealing with, if we accept that the restrictions we put in place have health impacts, we know they do. We know that isolation has a significant health impact. We know that there are serious mental health impacts as a result of people being lonely and disconnected from their social networks. We also know that things like unemployment and lack of access to education, all those things have serious impacts on people's health. We've been fighting for years to get an acknowledgement of the social determinants of health. So in some ways, this sort of, it's about health versus the economy is really a set of false choices. What we're talking about is a set of restrictions to deal with an urgent health problem, which will have immediate health impacts, versus restrictions which will cause longer term health impacts on the population. And I think if you start thinking of it in those terms, you get a sense of how difficult it is to weigh up those two competing priorities. I'll leave it there, Tim, and maybe you might want to fill in some of the blanks and talk a bit more about the Victorian response.
Thanks, Richard. I think Richard's actually covered all the main points. I'll just add a couple very quickly. I think based on a briefing we had last week that Victoria has more than doubled its ICU capacity. I also think that as the worst of the infection surge peaks in the Northern Hemisphere, in Italy and the United States, everywhere else, that the supply chain for ventilators and face masks and all that other stuff will improve for Australia, and also knowledge in how to treat severe cases of COVID will improve. There are clinical trials running at the moment in Australia and overseas, and some early results in those, not just in the stuff you've read about like hydroxychloroquine or whatever, but also, you know, how much oxygen do you nurse them on their front or their back? All those questions are currently being tested. So my feeling is that, you know, within a few months, by June, July or sometime, our hospitals will be as ready as perhaps they'll ever be to deal with this, which then confronts us with a difficult choice. If infections continue to dwindle down to nothing with our current policies, do we turn the tap on and say, righto, we're ready for it? Or do we continue to exercise border control, much as we do for animals coming to Australia already, and try and keep the infection out of Australia forever? I'll stop there because of the time, and we can discuss more if there's time for questions.
Thank you so much, Tim and Richard. As you've highlighted, it's a very complex area and there's layers of questions. So we'll get to some of that depth in the Q&A section, but thank you so much for that overview. That's really helpful. And now I'll throw over to Ellen and Janet, who are spearheading some of our key climate and environmental campaigns. We've been fielding a number of questions right across the board about what happens there. We've had some very questionable decisions being made at federal and state level over the last little while during this crisis. So over to you, Janet and Ellen.
Thanks, Sam. And look, just prior to sort of moving on to what's happening under the cover of COVID, I just wanted to highlight two other groups that we are really campaigning very hard for to make sure they're not left behind. And one being asylum seekers and people on temporary work visas who are basically being left totally stranded. And the second, for me, being very focused on the needs of LGBTIQ plus people. And I noticed there was a question in the chat box about sort of the definition of family, and I think it's a really big thing. We know that LGBTIQ plus people have got bigger mental health issues a lot of the time, and because of not being accepted for who they are, and then the whole challenges of everyone just presuming that sort of people are living as nuclear families and they are the people that are important to people, which just is not the case when you've got sort of sexuality and gender diversity. But look, on stuff, Ellen's going to cover sort of quite a few of the things that the Andrews government has sort of been doing, trying to get through while we're all focused on this pandemic. I just wanted to quickly focus on the federal state issue of the renewal of the regional forest agreements, which occurred just over a week ago, which, you know, we knew that it was coming. And so the governments would say, well, you know, we weren't doing it while necessarily to get it out while the pandemic was on, but they happened to decide on the renewal sort of on a Friday afternoon, when basically the worst time in the middle of a pandemic. And clearly they weren't pleased with it, because otherwise they would have made much more of a song and dance. So essentially we have got a rollover of the logging laws in Victoria that are allowing for ongoing logging of our native forests. Absolute devastation in the context of the bushfires over summer. It's, you know, an extraordinarily bad decision, with a few sort of weasel words of, oh yes, I'll sort of tighten some controls and sort of try and improve the environmental conditions that logging occurs under, but nothing that has got any rigorousness about it. And so that's something that we're going to be working very hard to see how we can be amplifying the campaign to be focused, getting a focus on protecting our native forests, because I think it's something, particularly after the awful summer of bushfires, people are really knowing what threats our forests and our wildlife are under. And so it's just a matter of working out how we effectively campaign in this era, in this time when we can't be bringing people together sort of in the ways that we would. But I've actually taken on a special project of working with a number of different forest organisations for getting some work underway for developing a campaign strategy for forest protection right across the country. So, you know, anybody who's keen and interested in forests, look out for that over the coming months, and because it's something that we're really going to continue to focus on. Look, I'll leave that there. I'll sort of hand over to Ellen, and then, but absolutely on other issues, happy to answer questions during the when we're done speaking.
Thanks, Janet. I'd like to talk about two things, specifically focusing on the Victorian Andrews government in particular. So firstly, why we need to be vigilant about what the Victorian government might do with their emergency powers and might do while we're all busy dealing with COVID. And secondly, how we can keep climate and environmental issues on the agenda, because these are not going away, as we know. So, as Janet mentioned, there have been some very questionable decisions made while we've been busy worrying about and dealing about the impacts of the COVID-19 pandemic. Janet mentioned the regional forest agreements, but here in Victoria, the first decision that was really snuck in under the cover of COVID was the decision by the Andrews Labor government to open up our state to onshore conventional gas drilling. So we know that they didn't need to make this decision at the start of the pandemic. They had many months that they could have left it. They didn't have that, the deadline was many months away, and so they could have made it a lot later, but they snuck it in right when the pandemic was becoming a big news story. And they also covered it by saying, oh, we're banning fracking, which is true, but at the same time they're opening up other forms of gas drilling, which we know is just as damaging for our climate. And we need to be very vigilant, because we know that more of these decisions may be made. The government may use our distraction to slip some of these particularly bad, unpopular decisions through. But also we know that the Minerals Council and the fossil fuel lobby are in their ear, asking them to make decisions about what happens when the immediate health threat diminishes. We know that the government will be looking for ways to stimulate the economy. They'll be looking for ways to create jobs. And the fossil fuel industry, make no mistake, is in their ear saying, come on, let's open up more fossil fuel projects. Come on, they're job creators, let's do it. And it will be very easy for governments, even good governments like the Andrews Labor government, to give in to that lobby. And so we need to be constantly on the lookout, not just now, but as the threat of the pandemic diminishes, look out for governments making bad decisions. And we won't go quiet on that in the Greens. We'll be out there calling them out when they do happen, and as much as you can amplify our voices as possible would be wonderful. And we also know that under the cover of these emergency powers, we need to be vigilant about how governments, and in particular how police, use these emergency powers. It's not surprising, but still very disappointing, that the first businesses in Victoria and in other states that were raided under these new police powers were sex work businesses. You know, government's just looking for a chance to go in and raid brothels under these new laws. On Friday, I was receiving reports from constituents who were very concerned because the police swarmed into Footscray and were harassing homeless people on the street, particularly harassing some of our African community and shutting down small businesses who were trying to do the right thing in very confusing circumstances. So there is a project that's been set up where you can actually report if you see the police doing something that you feel is really unfair. And so I encourage people to use that, because we can't let the government and the police have incredible emergency powers that they haven't had for a very long time. And we don't have Parliament sitting to keep them to account. So it's up to the community to also keep them to account. So now on to climate change. I know a lot of people are worried that now that there's so much attention on the pandemic, that people might forget about climate change or forget about the fires, and the fact that now that people are so worried about their own sense of security and safety and their own employment, that climate change and the environment was a first tier priority may now slip down the list. And I share that fear, but we saw some recent research that was very heartening that showed that now more than ever, people are feeling a really strong connection to each other, and they strongly believe that we're all in this together. And they also strongly believe in the power of government, which is not something that people always do believe in. So people trust governments to be making decisions, and they trust that we're all in this together. And so the thing that we need to do is to continually invoke those values of interconnectedness, of all of us helping each other, because that will help us not just now, but into the future when we need to deal with other similar problems that are about all of us being connected, such as climate change. And we need to be careful not to fall into the trap of, say, celebrating the fact that emissions are going down because there isn't as much airline travel, or things like that, because there is a bit of a fine line, because we don't want to tell people that dealing with climate change means we all need to go into forced isolation in a cave. That's not the kind of world that we've all been fighting for many decades. We're fighting for a world where we're all in this together and we're solving climate change together, and we create a better world, not a worse world where you can't see your friends and your kids can't see their grandparents and that no one has any jobs. That's not the world we're fighting for. But by invoking these values of interconnectedness, which are now really high up in people's minds, that will set us in good stead for dealing with climate change later on. And once the immediate threat of the health impacts has diminished, governments will be desperate for ideas for creating employment. And we can fill this space with good ideas that create jobs and solve climate and environmental problems together. And so that's what we're doing in my office, and I know the federal Greens are looking at this through, taking the ideas that we took to the last election and being very clear about what the jobs impacts would be, what the economic benefits would be. These are things like restoring the ecosystems damaged by the fires, creating people to do big regeneration projects, putting solar panels on all schools, fencing off our rivers to protect them from cattle, concrete projects that will employ people, and governments will be looking for these projects when the health threat diminishes. So we know that all of society has had a really big shock, and in times of crisis, ideas become possible that weren't possible before, and we need to make sure that the ideas the government picks up are not the ones that the fossil fuel lobby is putting in their heads, but the ones that the Greens and other like-minded people are out there talking about that will actually build us back to a better normal, as Adam talked about.
Thanks so much, Janet and Ellen. That was really insightful. Thanks for continuing that really, really important work. And I know there are some questions coming through already about some follow-up there. So thank you so much for that. Thank you, everyone, for sending in your questions. Thanks to our wonderful panel of speakers. And we're opening up the Q&A part of the discussion now. Adam's had to leave, as we mentioned before, but has answered a number of questions that were directed to him in the chat box. So you can keep up to date with some of his responses there, but we'll certainly follow up if there's further questions for Adam post this meeting. So let's kick off with our first question. It's from Mike, and it's regarding the arts. I might ask Ellen to start off, but if others want to jump in, please do. So that's how we'll run the Q&A session. Nominate an MP who's going to go the portfolio area, has been doing work in that area, but if there's somebody else who'd like to supplement that, please do. So Mike asks, Ellen, what is being done to fund the performing arts, a massive part of Melbourne's economy?
The short answer is not enough, unfortunately. The Greens at both federal and state level have called for some specific measures. So you may have seen Sarah Hanson-Young out there asking for a big art stimulus package very early on. And I believe she's also doing a webinar with the Australia Institute tomorrow that you might, if you Google the Australia Institute webinar and look that up, that might be something that is of interest to you. At a state level, I also got together a group of creative workers, so not just artists, but freelancers, people like designers, photographers, wedding photographers have lost all their business, florists have lost all their business. These are big artistic professions that are suffering. I got together a bunch of people and asked what state government interventions would be useful. And they said things like, why don't departments increase their design and photography budgets now and so that they could be employing designers remotely to do work that maybe they needed done in 6 months, to design things for their New Year's Eve festivals, get them to do it now so that there's a bit of a bridge for designers and other remote creative workers that they have work now. Things like grants to put work online and to create a new income stream for artists. But we also just need some survival grants and to make things like JobKeeper available to these freelance workers who are often working in small bursts rather than the long term. And we know that, so the TV industry and the film industry are really suffering because people can't get access to JobKeeper. So unfortunately, the government hasn't picked up a lot of that yet, but we're putting the ideas out there and we'll continue to advocate for them, because we know that the arts is what makes Melbourne great. And if you think about why do people come to Melbourne, the coffee and the arts, amongst other things. But they're really up there, and we need to protect that because we want a vibrant city to re-emerge after this is over.
Thank you, Ellen. We've got a couple of questions regarding people living with a disability. So I'll first take the question from Emmy, who asked about, and this has a health lens to it as well. So I might ask Tim and Richard if you'd like to start answering this one. And Emmy asked, how real are the concerns that prioritising of care may lead to people with a disability receiving reduced medical care? Have you seen much commentary about that, Richard and Tim, or like to make a comment?
Well, I'll just jump in quickly. Depending on the disability, some groups need additional dental care, and dentistry has just about come to a complete halt. So that's a particular area. The other thing that's stopped is non-urgent surgery, and also, again, for some disabilities, that's going to be a factor. The longer the shutdown goes on, we're going to have our already long elective surgery waiting lists are going to be outrageously long. So that, I think dealing with that is going to become increasingly urgent. It's something that we should be advocating for over time.
Yes, and just to add, I mean, obviously there's been a big change in the way people are accessing primary care services. So there've been a number of item numbers established for telehealth, and so people are accessing primary care providers, GPs, in different ways. But one of the concerns about that is that there are a number of people with ongoing chronic medical conditions, and in particular people living with disabilities, who are not accessing primary care in the numbers that they were previously. That's for a number of reasons. Some of them just very practical in terms of being able to access the supports that you need to be able to go and visit a primary care practitioner. Those things are becoming increasingly difficult. So it is a very real issue, and as Tim has said, it's got flow-on effects to elective surgery and other care, dental care. Physiotherapy is often very important in those settings. Jordan Steelejohn's been doing a hell of a lot of work with the disability community, and has been a very strong voice in the debate, representing the interests of people living with disabilities. Probably the sort of the singular, most, I think, important spokesperson on it. So I feel that we're very well represented having Jordan there as an advocate. But it's a massive issue. It's really causing huge dislocation within the community, in particular within the disability community.
Thanks very much, Richard and Tim. And Amy had a follow-up question as well. What about people with a disability who contract COVID? Do you know if there's any specialised responses there or adequate support? Or is that a bit of a gap?
I'm not. You might have something to say on this, Tim. I'm not aware of anything specific. And bearing in mind that the treatment for this, for COVID is very, very limited. It's a viral illness for which there's no specific treatment, and the only treatment really that we know that is effective is for people who develop serious complications and need to be supported in intensive care settings. People, basically machines to help people breathe when they get very, very sick. There are other things at the margins that we can use, but there really is very limited. It's more, what is the impact of COVID on the person's ability to be able to function, and pursue activities of daily living within the setting in which they live. What sort of additional supports are they getting? And that obviously has been an ongoing issue.
Thanks very much, Richard. And Hazel had a question also related to this area about whether we're engaging with disability activists as disabled people are not receiving extra financial help. I might answer that very quickly. I've got the portfolio for the state MPs team. As Richard mentioned, Jordan Steele-John, our federal senator, has been spearheading that work and been doing an incredible job liaising with activists and community groups and people directly affected, and we've come together as MPs, so MPs offices, state and federal, meeting quite regularly on these issues to think about a coordinated response, and certainly we have been speaking to people directly, and yeah, they've been doing a great job. I know last week in Parliament tried to move amendments to ensure that people with the disability on DSP supports are able to access the COVID supplement, but to no avail at the moment. The government hasn't been responsive, but we'll certainly continue that work. We'll move to, I think it's Michelle's question next, and Janet touched on this previously, and that was regarding how we define, in these kind of emergency powers and laws, what family means. So Michelle was citing an article in the Courier in April about people visiting people for the purpose of offering assistance and care. They'd be exempt from fines or reprimand from authorities, but it does state that family, the word family implies it's a typical basic social unit, so a nuclear family, and asked the question about queer communities. Janet, you talked about this a little bit before. Did you want to add anything further?
Yes, basically, first up, it's sort of a call for people to be exempt. That's not the case at the moment. In the regulations in Victoria, if you're offering specific care to someone, you're allowed to go and visit them. So I'm regularly visiting my 87-year-old mother to support her and where she's living alone. But in general, you're only allowed to have access, be with the people that you live with. But I think it does raise a question of, this presumption that everyone is living in nuclear families. Obviously, we know that there have been, people are being advised to restrict access to grandchildren, to grandparents, because older people are particularly vulnerable. But I think it's something that I think is a really good thing to note, Michelle, and really something that we should be doing more work on to raise. And certainly I'm focused on raising the issue that not everyone is living in a nuclear family of mum, dad, and the 2 kids.
Thanks very much, Janet. Tim, a question for you. From Kathleen, what advocacy are federal or state MPs able to do for prisoners, including basic things like finding out what access prisoners as well as people in immigration detention have to SOAP, and other things, plus getting some prisoners out of prison? Tim, I know you've been doing some work in this area. Would you like to comment?
Yes, so we've made a couple of approaches to the Minister for Corrections, and we got a briefing with the Commissioner for Corrections, Emma Hassar, and originally they issued the prisoners in Victoria with hand sanitizer that was non-alcohol based, and then they discovered that didn't work, so they took that back. And they tell me that they have been giving the prisoners soap, but we might just double check whether they're actually giving it to them or selling it to them, which does make a big difference. But we've been pushing for a reduction in the prison population. Even before this epidemic, we've been worried about the fact that we've got more prisoners in Victoria than we've ever had. And the rate of imprisonment per head of population has been going up. We've got, I think, about 7 prisons with more than 500 people. And so even if all they did was release everybody a month early, that would make a significant difference to the prison population. And we've been advocating privately and publicly for an early release scheme for low-risk prisoners. No actual success yet, but we'll continue to work in this space.
Great, thank you so much, Tim. We might move on to a question that we've had about the campaigns work that we're doing. So for Janet and Ellen, Steph asked, we've already seen environmental deregulation, diminished compliance, rush coal and gas approvals without parliamentary oversight, attacks on the rights of first people, all while coal, oil and gas companies are shielded from public health emergency measures as essential services. What else is coming and how can we respond?
Oh, what else is coming? Who knows? Who knows? I think that some governments will be attempting to support as much as they can. I know New South Wales are already seeing coal coal decisions happening. We have a campaign that's just about to launch, which is about Victorian coal, because we know we still, over 50% of our energy still comes from the dirtiest form of coal, and we have the dirtiest coal power stations in Victoria of anywhere in the country. And so keep an eye out for that. We're about to launch a new website and a campaign. I think an email's gone out if you want any stickers that say Victorian, we've got some messaging about Victorian coal on them, get in touch with my office. And just keep a look out for that campaign. We have delayed the launch of it a little bit because we couldn't get that much traction because the media is so focused on COVID, and so we'll just pick the right time to announce that. Immediately in Victoria, the next probably big decision is around our emission reduction targets. So the government was supposed to announce our emission reduction targets, and they have given themselves an extension to that because of COVID, which is a little bit concerning, I have to say, because they should have done all the work already. It's not like they need to be doing extra work at this time. They should have already decided. I think that they're probably, again, the fossil fuel lobby's in their ear saying, don't announce good targets because it'll reduce jobs. And so as much as possible, we should all just be contacting the Victorian government and putting stuff on social media saying, we need good, strong emission reduction targets. Climate change is still here.
I could add to that. I mean, it's a really good question, Steph, because we know the basic values in terms of, their propensity for supporting their corporate mates in exploitation and destruction of the planet and the environment are still the same. And we know, as you note in your question, that it's mining executives are the head of their sort of COVID commission. The other big issue, of course, at a federal level is that there's absolutely no parliamentary oversight of anything that gets decided because Parliament has been suspended, isn't coming back until August. There's an awful lot of things that they can just decide to do, and it's very hard for us to sort of get a focus on it because of everybody being focused on the pandemic, and because it's very hard to organise and sort of be noted with our online campaigning. So I think the challenge for us is to work out how we use our online campaigning and how we amplify our voices in this time. Last week, for example, the Bob Brown Foundation had an online rally about Tasmania's forests that had 1,000 people attend. So I think sort of having some more focus on that, particularly on the potential of really sort of climate destroying decisions being made under the cover of COVID is something that we need to be focused on.
Thank you, Janet and Ellen. And just a couple of follow-up questions there that we've received in the chat box. From Jessica to Ellen, do we know when the emissions reduction target decision will now be made?
No, we don't. We understand it should have been made already. So there was 2 points, the point at which they needed to make the decision and then the point at which they needed to publicly release the decision. They should have made the decision already. It hasn't been released. However, I suspect everything's back to the drawing board. Everything's back on the table now, and they may revisit those decisions. So I encourage everyone to contact by phone and email your state MP and the Premier. Tell them that you're watching and you still expect them to set strong targets.
Great. And just one more question on our campaigns there about timing of talking about these issues. So Carolyn's asked a question about when is a good time to highlight the fact that neglect of the environment actually plays a role in such pandemics and in future health crises.
Look, I think it's something that we essentially whilst we're in sort of the very beginning acute stage of this crisis, it was impossible to get people's focus on anything. I think now we're at a stage of, okay, we're sort of dealing with this, particularly as the numbers are going down. Yes, we've still got a big problem, and obviously we've still got the issues of the economic impacts, but I think it's possible now to have some sort of carefully honed messages that people may be able to listen to. And if you look at the media coverage, there is, increasingly this week, sort of an increase in other stories other than the pandemic actually getting some focus. And I think the other thing about the pandemic, as Ellen said, it means that people are sort of focusing on feeling connected to each other and knowing that really big things can happen and really, drastically change our way of life. mean, the positive story from this, I think, is that the things that governments have been saying for the last 30 years are impossible, that no, we can't do them because they're going to be so damaging to the economy, have been shown to be possible, because there's been this sense that this is an urgent action, lives are at threat. And so I think the potential of actually focusing on environmental problems and our climate and saying, look, you know, this is an urgent, absolutely urgent threat, and we take this action, I think has got the potential of having traction in the current environment.
Thanks so much, Janet. Time is rapidly moving ahead of us, so we're going to have to start wrapping up soon, but just some final questions. And Richard, you might want to have a go at answering this one first, but please feel free to anyone else who wants to jump in. And it's a question about New Start. So obviously the ongoing rate of New Start needs a clear response. Do the Greens have an opinion of universal income as an alternative or an addition? Does anyone want to tackle that one?
We've certainly explored the notion, look, laid on the table. I support universal basic income. I think it's a really good idea. The party has explored it as an option. I think there's a debate around the universal basic income versus a jobs guarantee, and there are pros and cons to both of those. But now's the time to be openly discussing what the various options look like. And Spain's just introduced a version of a UBI. Other countries or jurisdictions within other countries have implemented, albeit over shorter term periods, not like Spain's done, a version of a UBI. So I think it's a really exciting opportunity to pursue what was, as Janet just said, you know, the chance to have these conversations as we sort of coming to terms with what all of this means is over the coming months. And there's a huge opportunity for the Greens to be pushing universal basic income options like 4-day work week, which is something, again, we floated a little while ago. And I suppose just to add to what Janet said, I mean, one of the big problems that I think the government's going to have in the coming months is that they keep talking about, you know, a snapback and suddenly taking all this stuff away. But the impact of this crisis is going to go on for years. And they're going to find it very, very difficult, I think, to remove some of the supports that they've offered people. And even just insofar as New Start's concerned, a lot of more people have been exposed to living on New Start than ever before. And to go back to where it was, I just think will be almost impossible for the government. So I think we'll get some change. What that looks, but it's going to be a fight. Like, you know, this idea that somehow this is the end of neoliberalism and what we're facing is, you know, a huge transformation. And what the government's doing is they're going to fight tooth and nail to go back to business as usual. And they'll tell us that we need to cut spending on all sorts of important services to be able to pay for the cost of this crisis. And the job for us is to be able to continue to campaign on the sort of permanent long-term changes that make society a better place.
Thanks so much, Richard. Unfortunately, that brings us up to 2 o'clock, so we're going to have to wrap up now. There are so many fantastic questions that you've all asked in lots of different areas in terms of the post-COVID response, what the world's going to look like, what the Greens' role will be in there, asked about support for asylum seekers, oversight of government scrutiny, what the Greens have been doing a lot of work on, housing, mutual aid groups, and the list goes on. We will get back to your questions even if we haven't been able to answer them here today. We've got your contact details, so we'll email you as a follow-up with responses to your questions. But thanks everyone for that fantastic array of questions. So just before we wrap up, we've had a great response today. I think we've been nearing 100 or so people on this webinar, and I'm sure there's more that would have liked to have joined as well and in the future. So we'd like to know from you if you'd like us to do this again. You're going to have a poll is going to appear in by the magic of this webinar, I've been assured. There you go, the poll's come up. It's going to ask you a few questions, and would you like us to do this again? So if you'd like us to run one of these sessions again and continue them, please respond to that poll. We'll be getting to your questions as soon as possible as well via email. So on that note, I will wrap up. Thank you to our MPs. I know you're all very busy doing really incredible work. Really appreciate your time and efforts. Thanks everyone for joining the call. A special shout out to Ellen and her her team as well for all the background work in getting us together today. It's been really wonderful to be able to talk more in depth about our responses. Unfortunately, this is not ending anytime soon, so we look forward to staying in touch with you and hopefully doing this again very soon. So on that note, we'll say farewell.
Thanks for coming, everyone.
Thanks, everyone.
Bye, everyone.